Um, okay. Any advice for vaginal atrophy other than lubricant and estrogen pessaries?
Yeah, so again, in the same way that our skin can get a little drier and more fragile, and we might need to change facial moisturizers at midlife, using a good vaginal moisturizer a couple of times a week, really great way to start taking care of that tissue. Look at what you're eating as well. Are you taking in enough healthy fats in your diet? Because those essential fatty acids are really important for keeping the skin happy and healthy. And vitamin C is really important for good collagen formation as well. So, your nuts, your seeds, your avocados, your extra virgin olive oil, and then, citrus, peppers. To find vitamin C rich food that doesn't irritate, say, your bladder. If you're dealing with issues like interstitial cystitis or bladder pain syndrome, sometimes citrus or peppers can be a little bit irritating. But there are so many different foods, particularly our vegetable and fruit friends, that are very rich in vitamin C. Hydration it's so basic and so important. I mean, we all know when we're dehydrated, if you pick up, back in 150 years ago when I was a baby physio working in ICU, we'd go and we'd pick up the skin on the back of somebody's hand and watch how quickly it came back down again to see if they were dehydrated. So what's true for the skin up here is also true for the tissues down there as well. So oftentimes it is that fear of leakage maybe that can cause women to start restricting their fluids. And it's really, it will come back to bite you, because it can really just make those tissues even more irritable and dry and unhappy. So don't forget the basics. It's what you put on you, absolutely, but what you put in you in terms of nutrition, hydration, really important as well.
And apart from nutrition, hydration, and what you put in you in that way, any herbal medications for menopausal symptoms that you might recommend?
There is, but a couple of caveats with this as well. Just because a medicine is herbal or natural doesn't mean that it's universally safe, because if something is strong enough to have an effect on you, it is strong enough to interact with maybe other medications that you're having also. So I would be inclined to say, go talk to a good herbalist, talk to them about things like black cohosh, about red clover, about sage tea, because these all do have some evidence behind them. But a good herbalist will take your history into account and will also look at your medical history. Do you have blood pressure? Are you on any medications, for example? Because we really just want to be on the lookout for safety as well as efficacy, and any interaction between different medications. For example, St. John's wort, super popular, super powerful antidepressant, pain medication, but will interact with a lot of different medications. So yes will be the short answer, but do seek qualified help if you want to add some herbal medicines into your life.
Where do you source a good herbalist? Is there an association?
Absolutely. So there is the National Institute of Medical Herbalists in the UK, and they will be able to steer you to somebody local who'll be able to guide you. So look for somebody who has a specific interest, obviously, in women's health. There's some great books out there on herbal medicine as well, so I can certainly put those on the book list that I'll send over to you to distribute as well.
Okay, all right. And so it's the same for supplements, isn't it, really? Yeah. Okay.
For me, honestly, food is medicine first. So you can't, I don't know who said it first, but you can't supplement away a bad diet. If you are not eating well, there's really no point in taking a lot of expensive supplements or herbal remedies. Are you eating a primarily plant-based diet? Because that just seems to be the most suitable for women going through menopause and into life after menopause as well. Are you taking in enough essential fatty acids? Have you got a good balance of omega-3s as opposed to omega-6s? Yeah. Are you drinking enough water? Are you reducing your sugar intake? Are you reducing your alcohol intake? Are you reducing your nicotine intake? As well as, of course, are you eliminating what you don't need? Because we are what we don't poop out, essentially. And our bowel is actually the pathway that we eliminate excess hormones. So a lot of the symptoms that women have going through perimenopause are actually probably driven by estrogen dominance. So both estrogen and progesterone come down at perimenopause and into menopause, but sometimes there's a relative excess of estrogen compared to progesterone. And that's where we can get a lot of the hot flashes, tender breasts, mood swings coming in. So your body wants to eliminate that excess estrogen. So your liver helps to break it down, and then hopefully we're having nice, happy, healthy bowel movements every day to get rid of it. And a lot of the research shows that women who have a primarily plant-based diet are more efficient at excreting that excess estrogen than women who have maybe a slightly more carnivorous taste. I'm not saying you have to go completely vegetarian, but maybe just, we generally advise that the size of meat, if you are having animal protein, maybe the size of the palm of your hand, that's a serving, not a big steak hanging off the sides of the plate.
That's going to be very surprising to people.
I know. So 3/4 of your plate should be plants, basically, and meat as a condiment a couple of times a week. The Lancet report that came out, a better diet for us and a better diet for the planet, really suggested that we, as a population in the Western world, we really need to look at decreasing our animal protein intake in terms of cancer, diabetes, cardiovascular disease, and Alzheimer's. And a plant-based diet really seems to be protective, particularly for women, because once we go through menopause, our iron needs are actually much lower. Premenopausally, when we're menstruating and losing blood every month, we can veer into iron deficiency if we are purely vegetarian. But once we go through menopause, that's not an issue for us anymore. Right. So making good choices about what you put on your plate is really where good health starts.
Okay, all right. So I'm mindful we're coming up to 3 o'clock, and I wonder whether we can have a little bit more of your time. What do you think?
Absolutely.
We've got a few more. Great.
Absolutely.
So you talked about the good foods that we could be having and a good healthy diet. Would it be the same for dry vulval skin or skin in general?
Yeah, absolutely. Yeah. Again, those essential fatty acids, your vitamin C, and hydration. Those are really so important for connective tissue generally, but your skin particularly.
Okay. All right. Highly allergic vulval skin. Moisturizing helps for itching due to atrophy and dryness. So far, I can only tolerate Vaseline.
Ooh. Okay.
Any advice on that?
Vaseline, I would just explore maybe some different options. I'm a big fan of Yes products, and I have no commercial affiliation with them whatsoever. The two products I find myself recommending a lot are either Yes or Relivium from Desert Harvest, which is an aloe vera based product. Really nice, got some lidocaine in it as well. And those are quite nice products. Vaseline is a petrochemical byproduct. It is still recommended by a lot of gynaes. If you're having that sort of super sensitivity, I would also always recommend maybe just looking up the chain a little bit. How's your diet? Are you eliminating, how's your gut health? How's your microbiome doing? Are you eating a nice plant-rich, diverse diet? Some of the guidelines say we should be aiming for about 30 different plants a week, which can sound like a lot if you're not eating a lot of plants, but break it down to something manageable for you. But I think oftentimes skin sensitivities, whether it's in the vulva, the vagina, anywhere in the body, often we need to go back to good gut health and see what's happening there. Are we eating well? Are we absorbing well? Are we eliminating what we don't need well? because if we're not getting rid of it through the gut and through the bowel, then our body will try and eliminate it through the skin. And if you throw that into the mix with a scenario where there's decreased estrogen and the skin is a little bit more irritable anyway, I would look at, just maybe exploring what's going on from a gut health and a stress management point of view, checking for any constipation issues. But I think this is where it's really important that we don't just look at the vulva, that we actually look at the whole woman and see what's going on with her, taking a really good history and finding out how she's living her life on a day-to-day level, what helps, what irritates. And again, just doing good detective work to see if we can help her make good choices.
Okay. I've got a question here about atrophy and topical cream in a high-risk breast cancer environment.
Yeah. So that's a controversial one again. And topical estrogen would never be the first thing you would try in somebody who has a hormonally driven breast cancer. You would always do the lube, moisturizer, pelvic rehab, all those strategies first. There's very minimal systemic absorption of topical estrogen through the vulvar tissues, but there is some. And so this is where you have a fairly frank discussion with your oncologist about a risk-benefit ratio. With careful monitoring, if the quality of your life is so bad that it could be improved with topical estrogen, and you're doing a lot of very close monitoring to see what's happening there, is that an acceptable level of risk for you and your oncologist to have a discussion about? And that's kind of where the general thinking is, that it is a very individual decision, but if de-estrogenization of the tissues around the vulva is really impacting your quality of life, and you are making an informed decision, and you're going to be monitored very closely, I think that is a conversation that you would have, but it wouldn't be the first port of call by any means, but it's an issue that's being discussed in the literature on an ongoing basis over the past couple of years. So it used to be absolutely not, no way, never, and now it's sometimes maybe.
Okay. So have that conversation.
Yeah, absolutely. And remember as well that you are in charge of your healthcare team. So to go in armed with knowledge is power, and really to remember that you are steering the ship, and it is your body at the end of the day. We want you to have autonomy and self-efficacy and agency. So it's about having fairly frank and open discussions, and about coming in as equal partners with your healthcare team, not that sort of a power dynamic. I think that's really important.
Really important, yeah. Could estrogen be affecting the muscles around the groin and pelvic floor? Pain and coccyx too?
Yes. Estrogen affects pretty much everything. But again, as we were saying earlier, it can really affect tendons and muscles as well. And of course, the remedy is going to be a specific movement strategy that is bespoke to your situation. But yeah, absolutely. One of the things that, kind of, if we even circle back to the pudendal neuralgia question, sometimes women at midlife, if they're not exercising with intent and with focus, can maybe lose a little bit of muscle bulk, say in their glutes when they're sitting. And if you haven't got enough padding back there and you're sitting a lot, then that can actually start to irritate the pudendal nerve. And then it can also, be a culprit for constipation, which is going to further irritate your pudendal nerve because you're bearing down to have a bowel movement. Basically, just any question you ask is probably going to come back to bowel movements at this point. So what is the answer? It is about building appropriate levels of strength and flexibility and balance in around the pelvis. Just because you're going through menopause does not mean you can put on muscle tone. Of course you can put on muscle tone at any stage with a specific strength and training program. So it's really important that we don't just resign ourselves that it's menopause, I'm just getting older, this is my lot in life. You know, today's 50-year-olds compared to, say, 50-year-olds of 20, 30, 40 years ago, it's a different world. You know, women in their 50s now, we've got Jennifer Aniston, we've got Nigella, you know, 50 is the new fabulous, you know. And so menopause is not an excuse for living a diminished quality of life. And if you are suffering in any way, seek help, because there's help out there, whether it's your GP, your gynae, your pelvic floor physio. There are people out there to help you. And I think it's really important that we don't put up with pain and dysfunction when there's help out there for us. And sometimes we do have to, you know, we do have to be the squeaky wheel that shouts a lot till we get that help. But I think that's what we have to do, is empower women to speak up and say, you know what, no, this isn't right. Pain isn't normal. Pain is a sign that something needs attention. And if you keep ignoring that cry from your body for attention, it just shouts louder.
Yeah, take action, absolutely.
Listen and obey.
How do I know how bad my hormones are off, and how can I regulate them?
How are you feeling? Would be the first question that I would ask. That's probably the best indicator. Rather than a series of lab results. It is, you know, it can be quite informative to get your bloods done and to, you know, to see what your levels are. But if you are going to your GP in the NHS, they're going to look at a very narrow range of blood levels for testing. That might not give you the bigger picture. At the end of the day, I think looking at yourself, how are you feeling? That's the best barometer of what's going on. I've had some women, you know, and who've had, you know, they've only felt better as they have moved through menopause. And for other women, it's been catastrophic. You know, what's going on in terms of your thyroid? What's going on in terms of your mental health? You know, there's so many different factors here. What can you do to keep living well? Eat well, move well, poop well.
I love that.
And sleep well. It is literally that simple, you know. I mean, it sounds very simple. There are lots of steps that go into that. And, you know, there can be socioeconomic barriers to eating well too, because I think there's never been a time when there's been more cookery shows available to us on TV or on the internet. But are we actually cooking? Because I think there is still a perception that cooking from scratch is expensive and a bit of a faff. And I think one of the greatest travesties that we have perpetrated in the Western world is the removal of home economics from school curriculum. Because when was the last time you used trigonometry? You know, but we have to eat at least 3 times a day. And knowing how to shop well, how to cook, you know, how to budget, I think those are such important life skills when it comes to lifelong health. And yet we don't rate them as highly as Archimedes. He's been dead a long
time. So we've got a couple more questions that have come in. How to improve bladder oversensitivity to cold? A slight draft or cold wind outside make me feel extreme urge to pee for the whole day or two.
Yeah. So sometimes that can actually be driven by what happens if, you know, you say you come out of a sauna or it's super warm, you're at the beach and it's really warm and you run into the cold sea or you dive into like a plunge pool of ice. What happens to your whole body? It tenses up. So if a cold breeze comes along or you're suddenly caught in the rain, what can happen is your whole body tenses, pelvic floor tenses, but maybe you're bearing down a little bit on the bladder as well. And that can just push it down a little bit and squeeze a little bit of urine out or make you feel like you're going to leak as well. So the first thing to do is, if you're anticipating getting cold, because it's been beautiful weather for the past couple of weeks, but we all know that summertime in this part of the world is notoriously unpredictable. And as they say in Game of Thrones, winter is coming. Making sure that you have layers on, and if you get a sudden chill, that you're not bearing down. Okay, that you're relaxing the pelvic floor, that you're not carrying that tension and pushing down, that you're actually consciously aware of being supported in your pelvis, which hopefully you will be if you've been doing your pelvic floor exercises properly and you're not constipated.
Okay, great. And then one final one here. Do you ever recommend natural progesterone cream for endometriosis or too much estrogen? If so, would it just be for a short-term use, not long-term, and for perimenopause?
So there's a couple of different things in there.
Yeah.
The gold standard treatment for endometriosis is surgical excision, followed by pelvic rehab. You do not want to suppress the disease with hormones, with birth control pills or Lupron. You want to actually take the disease out. Hysterectomy is not a cure for endometriosis, which is the growth of tissue that is similar to, but different from, the lining of your womb in places outside the pelvis. So for a long time, hysterectomy was offered as a management strategy for that. And it doesn't work as a management strategy for endo because the endo can come back. The disease itself needs to be removed. And if someone's having a hysterectomy, then they have to deal with all the fallout from a hysterectomy, which is a very casually done surgery to women that has enormous implications for heart health, brain health, bone health, and mortality as well as morbidity. So that's a whole different discussion that we could have. The progesterone creams that you can buy in, say, a health food shop are based on wild yam. It is not bioidentical progesterone. The wild yam that they use in progesterone creams that you get that are pharmaceutically compounded and graded is converted in a lab into bioidentical progesterone. If you are buying it in a health food shop, you are probably just buying an expensive moisturizer.
All right. So, you know, what I've taken from this, I think I've taken a lot from it, but eat well, move well, poop well, sleep well. I think that's going to stick with me. So in terms of resources, you're going to send us over a list, which perhaps if you can get that through to us, I can put that in the email tomorrow together with the replay. Is that doable?
That is feasible.
Brilliant. And so to wrap up then, what's your top tip for menopausal well-being?
Pay attention to yourself. You know, and take care of yourself. Listen to what your body is telling you. Listen and obey, because your body will always win. But don't make it shout too loudly. You know, just pay attention to yourself. Prioritize your self-care. If something doesn't feel right, seek attention for it and don't get fobbed off. But do the work. You have to do your work as well, which is eat well, move well, poop well, sleep well. If you are doing everything right and you're still not feeling well, then it's time to take it to the next level and get some answers.
Right. Yeah. Brilliant. Thank you so much. Michelle, brilliant. Before I tell everyone who's on next week, just to say a thank you to everyone who's donated. It means that we can continue running these. After this webinar, there'll be a donations page that comes up. If you're watching the replay, there'll be a link towards the bottom of the screen. Any small donation, if you can, is really appreciated. And our website's getting a makeover at the moment, something that we've been working on in the background. Once it's live, all the webinars, and so we've now, including you, we've got 9 in total of these new webinars. These replays will go on the new website. But in the meantime, if you want to have a replay of any of those or find out what we've covered, because there's quite a lot of topics on vulval pain, then get in touch with us, info@vulvalpainsociety.org. And then we'll be getting more up-to-date resources, information on the new website too. But for now, you've got our current website, which already contains lots of fabulous resources. So next week, when we ran a poll to ask which topics to cover, this topic was really popular, and it's pain self-management. And I think that ties in really nicely, Michelle, to kind of paying attention to yourself and, you know, what's your body telling you? Listen to your body. So pain self-management. Our expert next Friday the 12th at 2 p.m. is Pete Moore from Pain Toolkit. I can't think of anyone more suitable to answer questions on pain self-management. So the sign-up link is going to be emailed out tomorrow. And what we're going to do this time is, for the first 30 people who register, you can ask your question in advance. After that, we're just going to take questions live on the day to keep it really interactive. If you follow us on Facebook or Twitter, you'll see sign up links on there too. And I really, really hope you can join us for this one. You asked for it, you know, we're going to deliver. So today, thank you again, Michelle Lyons.
Pleasure. I'm absolutely delighted to be here, and thank you for all you do, because I think it's so important to help women with chronic pelvic pain, because so many women think they're the only one. Yeah. And it's great to have a network like this to support them. So I want to really encourage everybody to make a donation to support the work that you do.
Oh, thank you, Michelle. That's lovely. So hopefully we'll see you again, because I think we're going to have more questions on this. It's such a, you know, wide, broad topic, but certainly eat well, move well, poop well, sleep well. And on that note, thank you all for joining us, and see you next time. Bye for now.
Bye-bye.